So what would a session look like with me? What would an appointment consist of? I wanted to try to explain a little bit about my work and how I work. It's very difficult to explain how a session would look, but we do allow an hour for our assessments because the whole nature of my practice has always been about an holistic approach to a patient's problems. So it will always consist of a thorough assessment, a lot of history taking, and the clues are in the history. So I really want people to be aware that we will probably spend potentially 20 minutes, maybe even longer, in a history taking, because often people want to get onto the couch straight away. Really, this isn't just booking an eyelash tint and saying I want this. Really, you wouldn't go to a consultant surgeon and say, well, I think I want a knee joint replacement. Well, he might say, well, okay, let's take a look and see whether that's the right thing for me. You tell me what's going on. You tell me your history. So certainly we take a thorough history, then there'd be a physical examination potentially, and treatment usually would commence within that first appointment. That's a fairly standard physiotherapy approach. Now, for my work, I work very mind and body, and a lot of my work is in complex chronic problems, chronic pain, often where internal health issues like IBS are going alongside perhaps some anxiety and some back pain. Now, it might be the back pain or perhaps some dizziness that brings somebody along, or even jaw problems commonly. Now, it may be that we stay in a fairly physical domain and that we stay quite orthopedic, if you like, if that's what's right for you. And I might use myofascial approaches, craniosacral hands-on techniques. So I will still use manual therapy and hands-on techniques and rehabilitation if that's what you need. And it's often part of a recipe, if you like, of a bit of this and a bit of that and a bit of the other. But often I will be looking at what the nervous system is doing and perhaps why that's causing pain, or why that's causing chronic inflammation or autoimmune problems, issues with long COVID, for example. We really need to be looking to what was the state of the nervous system before the COVID vaccination or the COVID infection affected you. And the studies have certainly borne out my gut feeling as I began to work with long COVID, that so often people don't get long COVID unless there is some dysregulation of the nervous system beforehand. So we need to understand what may have dysregulated that nervous system, and that might go into relationship issues, early childhood neuropsychodevelopment issues. And so sometimes we'll be looking back at those histories or traumatic events that may have happened, separations, divorces, etc. Sometimes in that kind of work, the session just really evolves, and we might just stay helping you to sit with sensations and to begin to unpick and uncouple some of the belief systems, some of the patterns that the body has of, well, I experience this sensation, and then what does my body do with it? Does it shut it down in the body? And now I notice that as we're talking about this and I'm feeling this frustration coming up, now I've got this rising sensation. There's that headache starting to come on. Aha, interesting. So then we might start to look at how we can help your nervous system do something different with that. And that's often using somatic therapy, which is sort of a form of body psychotherapy. We work with the sensations within the body as well as what's going on cognitively. It might be that we look at early formative years developmental psychology. It might be that we look at movement and body patterns of tension in how you move differently, and look to use movement therapies to help to change patterns and release tension within the body. So it's a really very varied set of tools that I might use. So I wanted to just put this together to give people some kind of expectation. So I guess really the summary is kind of anything goes really, and come with an open mind, I would say, because the clues are in the history. And I'm minded of a book which was a very manual, hands-on book that I read as a student by Jeff Maitland, and there's something stuck with me which says it's really important, and I can still remember it, when he was talking about assessment. And he said, if you listen to your patients, they will tell you their diagnosis. And nothing could be further from the truth, because I'm not psychic. If we get you, what is the skill of listening? That may be words, it may be noticing your body language, it may be noticing, that's interesting, I'm just noticing, or I'm feeling, what do you notice? Your face has just changed colour there, what are you noticing? That's the body's communication, okay? So really listening to your story in words and in non-words is how I work, to try to understand what's really going on, and then put together. The technique is less important, but we just choose what we think is right for you. And it may be that you go, I don't feel comfortable going down. Well, then we don't, then we'll stay in that physical domain, and that's absolutely fine. But this is about the relationship. And in another video, I'm going to talk about the therapeutic alliance and this relationship, which to me is so important, and developing that therapeutic alliance about how we move forward together in the therapy sessions. Anyway, I hope this is helpful. I'll see you again soon. Bye.